Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and today we're going to show you how you can save money in healthcare and what is the most important factor for you in the cost of your healthcare going forward. So first off, let's go over some basics with health insurance, okay? And we all know that we're going through healthcare reform right now, but you need to know how much your healthcare is going to cost from here on out. So in this column, let's go over some healthcare stuff. So premiums. Premium is the amount of money that it costs just to have health insurance. And normally you have to pay this every month. Just to have healthcare coverage, you have to pay a premium. We all know that premiums are going up. You know, healthcare is getting more expensive to have. The next one is the deductible. The deductible is how much money the patient or you have to pay out of pocket before your health insurance starts covering the rest of the bill. Deductibles are also going up. It could be as small as $500 or as high as $10,000, okay? But that's important for you because that's how much money you have to pay before your health care starts covering, or your health insurance starts covering the bill. The next one is the copay. Sometimes if you go and see a specialist, maybe you'll have a copay, a $20 copay, a $75 copay if you're going to see a specialist. The coinsurance is normally 10 or 20%. And this is after everything's done, the bill is $5,000. Your health insurance will cover 90 to 80% of it, and you're left with 10 or 20% of it after that. So you do have to watch and see what your coinsurance is. So overall, those are the four main factors with your health insurance. The point is that healthcare is going towards major medical coverage or catastrophic coverage, meaning it's only going to cover major surgeries, major medical conditions, and it's not going to cover the small stuff anymore. And that's where you, the patient, is going to be more obligated to pay out of pocket for your services. A perfect example of this is like your auto insurance. Your auto insurance is going to cover if you get into a major accident to repair the healthcare stuff or your car, okay? But it's not going to cover the maintenance stuff like tires, tire rotations, new tires, oil changes and stuff like that. It's not going to cover the small stuff, and you have to pay out of pocket for that. So generally, health insurance nowadays is going towards major medical stuff and more catastrophic coverage. So what does that mean for you? That means that the most important thing that you have to pay attention to is what is your deductible. Remember, that is the out-of-pocket amount that you have to pay before your health insurance kicks in. And the average one is probably like $5,000, okay? So that means that you have to pay $5,000 for your treatment before your health insurance kicks in. Okay, so let's go over a few examples here of what does that mean to you. So given the fact that you have a $5,000 deductible or $2,000, whatever, you know, and say, let's use the case of lower back pain, because lower back pain is the most common injury that we see here. So say you have lower back pain and you have a $5,000 deductible, meaning you have to pay for your treatment up to $5,000. So let's go over three options here, and let me show you how we can help you save money. And this is actually a good thing because now it creates competition, and now you have to ask the right questions. Or one, what is the best treatment for my lower back pain? And two, how much is it going to cost? Because you have that $5,000 deductible. So let's go over option one, okay? You have low back pain, you have a $5,000 deductible. Here you pay for a evaluation, you walk in with low back pain, you're told that you have low back pain. You're given some medications, you get an x-ray, which you probably don't really need for most acute cases of lower back pain. Then you're referred out to a specialist. You may have to wait a couple weeks later, you get a second eval for the same low back pain, and you're given some possible injections or some stronger pain medications. Take it you're paying for all this out of pocket. Then you get an MRI, which may or may not be needed. Again, most of the time it's not needed for acute cases. Then you're given some stronger pain meds, and then you're referred. And then maybe you're sent to physiotherapy, which you get a third evaluation for the same low back pain, and then you start treatment when you're forced to come in 3 times a week for 4 weeks. So in standard healthcare, this is the route that you may end up taking, and what is that going to cost you? $5,000. So you have to pay out of pocket for that standard healthcare approach, okay? Let's look at another option. So you go to another clinic and you get an evaluation and they want to start treatment, and you do a package, and they tell you that you want to be seen 2 times a week for 8 months. And the cost is $4,000, okay? Is that the best option for you? I would say one thing: if you're being treated 8 months from now for the same condition that you used to have, it's not really working. You're just covering up symptoms. But that's something that you have to decide. So this option is $4,000. This option is $5,000. Okay. Now, what's the next option? Here at Pursuit Physiotherapy, we get you in for a thorough evaluation. We solve the root cause of your problem. We look at risk factors, and we only implement proven treatment approaches. Okay, and depending, our easy cases end up getting better in 2 to 6 visits, and in 2 weeks you're pain-free and done. More complex cases, we do treatment packages. But in 2016, the average cost of care at Pursuit Physiotherapy per case, $805. And plus we have a money-back guarantee. Our treatment packages have money-back guarantees, meaning in up to 4 sessions, if you feel that we're wasting your time and we're not helping you, we don't feel it's right to ask you to pay cash if we can't truly help you. So we even give our patients a money-back guarantee, that rest assured that if you want us to try treatment and you feel it's not working and you're not a good fit for you, we give you your money back. So if you look at these options in the new age of healthcare, and you have a high deductible, you, the patient, have to start asking yourself, what is the best treatment for me, and how much is it going to cost? Because deductibles are going to stay high. So you have to ask yourself those questions and look at options now. Do I want to go option 1 through standard healthcare? It's going to cost me $5,000. Do I want to go to option 2? It sounds nice, it's a lot shorter, but it's going to cost me $4,000. Here at Pursuit Physiotherapy, our average cost of care was $805 in 2016. So we're improving. We have a cost-effective model that can help you save money that you're going to spend on healthcare. And the key with this is educating the public about healthcare and the new trends and what is best for the patient. Because when it comes down to it, if you have a case of low back pain, you need proven treatment approaches that are proven to work for low back pain cases, and that's going to be the cheapest for you. So let us know if you have any questions. Visit our website at pursuittherapy.com, and thank you for your time.